What about the pace of vaccinations? India is definitely a little concerned about the slow pace of vaccination, especially when it comes to the second dose, not so much for the first one. The country, remember, is racing against time to ensure better second dose coverage, and all of the might has been thrown behind the government's Har Ghar Dastak campaign. Here's a ground report. It is the next big challenge in India's pandemic fight, the war against the hesitancy virus. The government has now taken this fight door to door. Asha, ANM and other village-level health workers from Uttar Pradesh are carrying out the government's Har Ghar Dastak campaign, door-to-door campaign to beat vaccine hesitancy, encouraging them to take a shot against COVID-19. The idea? Improve the second dose coverage, in which India is still far behind. India's second dose coverage is at 45%, far below the expected coverage of 100% by year-end. First dose coverage stands at almost 83%. Reasons for this lag are many.
घर में किसने नहीं लगवाई है?
मेरी सास ने अभी नहीं लगवाई।
क्यों नहीं लगवाई?
उनको ना अस्थमा की प्रॉब्लम है, तो अभी हमने डॉक्टर से कंसल्ट नहीं करा है। अब कंसल्ट करके उसके बाद ही लगवाएंगे। कल देखते हैं फिर हम।
आपकी कोई दवाई चलती है?
हाँ।
23 साल क्यों? 23 साल में क्या दवाई चलती है मैडम?
मतलब जो कि उसमें बच्चा जाने में रस हो रही है ना, उसकी चलती है।
तो इसलिए वैक्सीन नहीं लगवाई। कभी डॉक्टर से पूछा आपने कि अगर वैक्सीन मैं लगवाऊं मुझे कुछ होगा कि नहीं होगा?
अभी नहीं पूछा मैंने।
आप पूछोगे या लगवाओगे अभी जाके?
अब पता नहीं, पूछनी पड़ेगी पहले तो।
मैडम
लगवा लेना,
अभी जाके लगवाइए।
ठीक है।
There are some who are afraid all this while, but have finally mustered the courage.
डर तो लग रहा, मुझे नहीं लगवाई।
तो अभी इनके आने से आपको डर लग रहा है कि कुछ नहीं होगा?
मैंने कहा जब सब लगवा रहे तो मैं भी लगवा लूं।
किस बात का डर?
बस इन्हों ही कह रहे कि सब इसे लगवाने से मर जाएंगे।
As is evident, most people in this particular locality seem to be suggesting that the people who have not taken the vaccines are the ones with some underlying healthcare conditions. The ASHA workers here are trying to tell them that even if there are underlying healthcare conditions, then there is a way out of the situation. You can always have a consultation with the doctor and decide on how to go about taking the vaccine. But vaccination is a must, is what the healthcare workers here are trying to communicate very regularly to the people living in this area.
See, somewhere we are dealing with a segment of people. See, illiteracy is one issue in the country. So I think that is a hurdle in the thing. See, they don't know the merits of the vaccine. So once we tell them the merits of the vaccine, they definitely take it up.
Government authorities have also had to use help from religious institutions and leaders to help people overcome the fear of the vaccine.
गाहे बगाए जब भी जैसा मौका होता है, मदरसे में, मस्जिद पे और स्कूलों में बाकायदा कैंप लगवा करके हमने टीकाकरण करवाया है। गली मोहल्ले में घूम करके भी करवाया है और आज भी करवा रहे हैं।
पहले डर था लोगों में, आपको लगता है? डर, घबराहट, जानते नहीं थे?
थोड़ा लोगों ने भय डाल रखा था, मगर ऐसा कुछ नहीं है।
Government sources say they hope for at least 90% coverage of the population using the first dose by year-end. Second dose coverage may just go beyond 50% by January, and that is rather worrisome. Given that data suggests that vaccines reduce severe illness, the campaign Har Ghar Dastak is what India needs right now. In these villages, in rural areas, in different parts of the country, in tribal areas, teams have gone all across to try and convince people to get a shot against COVID-19. The idea here is to beat vaccine hesitancy, because without beating vaccine hesitancy, one can't beat COVID-19, the infection. The idea is to ensure better first dose coverage and also good second dose coverage, something where we are still lagging behind. With video journalist Pradeep Gupta in Ghaziabad, Sneha Murdani for India Today.